Brian McDonough Show.
Hello, this is Dr. Brian McDonough, and welcome to a special edition of Healing Healthcare. My guest really needs no introduction, but I'll introduce him anyway. He's Dr. Steve Permut. Dr. Permut is a physician. He's an attorney. He has created a residency program which trains young physicians. He has been a chief medical officer. He's worked in the insurance business. He's been the chairman of a major medical school department. He's been a delegate of the AMA. Pretty much in his career, he's done everything. Steve, thank you for joining us on the program. I really appreciate it.
Ryan, always a pleasure to be with you.
My question is, you pretty much have seen it all for the last 5 decades or so in healthcare. And we're at a point right now, which is probably, some say, a very pivotal time in healthcare. Hospitals right now are in a situation where they're dealing with the impact of COVID. People are stressed. They're overpaying nurses who are traveling. There's physicians and other people who are burning out. A lot's going on. Tell me where we are in your eyes in healthcare, and are we in trouble? Are we better than we've ever been? What's your perspective?
Yes.
We're in trouble and we're better than we've ever been. In other words, what you're saying is it's good and bad?
Right. Everything you've said is basically true. We're in trouble, but we're also in a better place than we've ever been. So, 100 years ago, we went through a pandemic. Philadelphia, where we're seated, was ground zero for the pandemic of 1918. We didn't learn a lot of things at the time of that pandemic. And when this pandemic hit, we were essentially at the same place where we were 100 years earlier. The one difference is that we had invested in science, and in an amazingly short period of time, we were able to come up with 3, 4, now 5 very effective vaccines against this virus. And as you know, of all of the infectious organisms that we have to deal with, viruses are the most difficult to treat. But yet, in a relatively short span of time, we had an effective vaccine that has dramatically reduced death and injury from this very communicable virus. And as we speak, there is another wave of a new variant of the Omicron virus that is tearing across the country. But thank goodness, people aren't getting tremendously sick. People who are fully vaccinated and boosted are not getting tremendously sick from this latest variant. So in that sense, we're in a good position.
There's so many things to unpack when we talk about healthcare and where we are and this pandemic. Healthcare, this has happened before, but health became very political with HIV. I remember it became very political now when we're talking about COVID. When politics gets meshed with medicine, is it a good thing, a bad thing? Is it just part of the normal process? What's your take on it?
The political situation we're currently in is just untenable. The thing is, though, that if you look at healthcare in this country, even though we do not have a single payer system, and I don't think we should have a single payer system, I would say in excess of 60 to 65% of US healthcare is paid for by the government. And the government is involved in funding the research that leads to the tremendous technologies that have allowed us to respond to COVID in such prompt fashion. The thing is that you can't get money out of the government without going through Congress, and that makes it very political.
You started in medicine, I would say probably mid-70s or so. That's probably when you got going. And obviously, at a very young man, you created a residency program when people weren't. I mean, to give a background for those who are listening or watching, I mean, he is an internist who then joins the fledgling field of family medicine and starts to provide total care, and then starts a residency training young physicians. And that's all probably before you were in your mid-30s. I mean, probably maybe even younger. It was a different time. Tell me about that time.
Well, I mean, if you look back, I mean, we're looking back 45 years. I started a solo private practice in the inner city of Wilmington in a diverse community, which is where I wanted to practice. I ran a solo private practice with one employee. We saw the patients efficiently. We drew bloods there. We did flexible sigmoidoscopy there. We did originally rigid sigmoidoscopies there, but with just one employee and really minimal overhead. If you look at the national averages for the overhead for family medicine and most ambulatory practices, it's staggering. It's in excess of 60% overhead, between 3 to 5 full-time employees to support each full-time physician. And again, in 1975, I had one full-time employee with predominantly an accounting background who was able to support my practice. So the cost of practice has just gone off the charts. You can't mention that without saying that over literally the last 25 years, Medicare has not increased physician fees at all.
The Dr. Brian McDonough Show.